Hi, I'm Dr. Erin Rushing, audiologist and owner of Comprehensive Hearing Solutions, and I wanted to talk to you today about types of hearing loss. So we actually categorize hearing loss as three different types: conductive hearing loss, sensory neural hearing loss, or mixed hearing loss. And it's based on the anatomy of the hearing system and what component we think has the breakdown or the problem. And so let's review the hearing system or the anatomy. So this is an image of the peripheral hearing system. We have it divided into three main parts: the outer ear, the middle ear, and the inner ear. So the outer ear is the pinna and the ear canal. The middle ear consists of the eardrum, the bones of the ear, and an air-filled space. And then this inner ear is the cochlea, and it connects to the auditory nerve that is leaving to head toward that central auditory system. So when we perform diagnostic assessments, we determine what part of the ear has a breakdown, and that determines the type of hearing loss that the person has. So if we look at a conductive hearing loss, it is a problem in the outer or middle ear. So sound literally cannot be conducted through those areas. When the problems that could occur might be a blockage in the outer ear, a problem with the eardrum or the bones of the middle ear, or maybe there's fluid or a mass in that space that's supposed to be air-filled. When we look at the audiogram of someone who has a conductive hearing loss, we see that their bone conduction scores are in the normal range, but their air conduction scores are not. And we actually call this a air-bone gap. And so that's one of our major clues that something is going on in the outer or middle ear, and again called a conductive hearing loss. If someone has a sensory neural hearing loss, that's occurring in the cochlea or higher up on the nerve, or maybe the connection between the two of them, and that occurs in the inner ear. On an audiogram of someone with a sensory neural hearing loss, the bone conduction and air conduction scores are very close together, if not exactly the same. So that's what the audiogram would look like. And problems that cause sensory neural hearing loss are typically noise exposure, aging, it's damage to those structures in that inner ear or along the nerve. When someone has a mixed hearing loss, they have both a conductive and a sensory neural hearing loss. So they have two issues going on at once. And when we look at their audiogram, we can see that there is an air-bone gap. Their bone conduction scores are still better than their air conduction scores. However, their bone conduction scores are also not in the normal range. So we have a sensory neural component here and then a conductive component here. So again, it's a combination of both conductive and sensory neural hearing loss that we term mixed hearing loss. So I hope this helps to get a better understanding of the types of hearing loss and how that fits with the actual anatomy of the peripheral hearing system.